All yours,
right.
Gisele. Thank
Yep.
you.
First on the agenda is to approve the November 24, 2025 Commission meeting minutes and the January 13, 2026 Senior Center Committee report, along with the next meeting for February 23rd at 4 p.m., which is going to be in Teams.
I make a motion to approve both the meetings that were just discussed.
Can I have a
I
second?
can second.
Thank you. All in favor?
Aye.
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 Perfect. And then next on the agenda is we have a speaker today who is our own commission member, Nikkei. Hopefully I said that correctly.
Yeah.
And she will be giving us a presentation. So all yours, unless Amy, you have anything for us.
No, thank you everyone for joining us, and special thanks to Nikkei.
Thank you. So I'm just going to share my screen now. We can get started. Can you see anything?
Yes.
We can see.
Yes,
Okay.
thank you.
Awesome. Awesome. Okay. Yeah. So I will be taking us through a few things. This is a research that we conducted, and I'll talk a little bit more about it. But thank you, Amy, for giving me the opportunity to present this work, and thank you all for being here this cold weather. So I'll be talking about elder abuse reporting and adult protective response. Really, it's just the relationship between adult protective services and the reporters of elder abuse, looking at the feedback loop between these two groups. And I expect my colleague to be here. Hopefully she still can join in, Christine Lee Zagati. We did this work together, so I hope she can still join us at some point. But I want to acknowledge a few things. One is that this research was funded by the National Institute of Justice. They gave us the grant to do this work, and we're grateful for that. We also conducted this work between 2021 and 2023 under Christine Lee Zagati's leadership at the Education Development Center. There are other contributors to this work. And I think she's trying to join in now. There are other contributors to this work. We have Randy Campity, we have Kathy Greenlee. Sorry, did somebody say something? Okay. So we have Randy Campity, we have Kathy Greenlee, who also contributed to this work. The work has been presented in a couple of places, including webinar as well as conferences that included the National Association of Adult Protective Services. And we've also published this work both as a technical report and as an academic journal to the Journal of Elder Abuse and Neglect. So I think Christine is here. At this point, I'm just going to introduce myself a bit and turn it over to Christine to introduce herself as well. I'm, of course, a member of this commission, and I'm also a researcher and a policy advocate with a growing interest in aging. I'm interested in long-term care as well as elder justice work. Yeah, I'll stop there, but that's the bio right there on the screen, and then I'll turn it to Christine to briefly introduce herself as well. Hi, Christine.
Hi, everybody. I'm so sorry for being late. I'm all out of sorts with the snow day and the kids home today. I'm Kristen Lees Haggerty. I'm a researcher and project director at Education Development Center. And I had the pleasure of working with Nikkei on the project we're going to present to you today. And I'm also kind of related to this work. I'm the director of the National Co-Laboratory to Address Elder Mistreatment. So thrilled to be here, and more soon.
Yeah, thank you, Christine. Okay. So we're going to go through a few things today, just to talk about the background of this work and the methods, the key findings from the research, and then some of the recommendations that were presented. And then we'll open it up for question and answer. So in terms of the background, I don't think elder mistreatment is something that is new to anyone here on this call. It is a prevalent issue here in the US, and it can take several forms: physical abuse, emotional abuse, financial exploitation, sexual abuse, and even more prevalent is neglect, particularly self-neglect, which account for 21.7% of the cases that are reported, elder abuse cases that are reported here in the US. We also do know that 1 in 10 people ages 60 and above experience some form of mistreatment, and only 1 in 24 cases are being reported to authorities. By 2030, 7.3 million older adults in the US will experience some form of mistreatment, and more than 7 million of those cases will be unreported, to go unreported to authorities. So this is really a prevalent issue. And all of this data kind of inform what the key issue we try to address in our research is. We want to understand the underreporting, what informs the underreporting of elder abuse in the US, and also even when it is reported, there's also communication gap between the reporters and adult protective services. So these are the 2 main issues that we were trying to understand by our research. And the goal of the research is to understand the barriers and the facilitators to reporting, and then we developed some recommendation, as I mentioned earlier. So what method did we use? We used 2 main methods. One is to do like an environmental scan of APS policies and practices. And then we did a case study here in Massachusetts. So for the environmental scan, we looked at publicly available data, pretty much websites, APS websites and some extant materials. We pulled data from there. We also did a secondary analysis of an existing data that we had, which was a focus group with EMS providers and APS in Texas and Massachusetts. Then we did interview. This was really a huge part of our work. We did interview with over 40 APS leaders across the US. We did, I think about 24 states. We interviewed leaders from 24 states, spoke with about 40 to 44 of them from those states. Then for Massachusetts, we did an analysis, descriptive analysis of APS's data. So we examined all of those data for trends in reporting, what kind of cases are being reported, who is making those reports. We did an analysis of that. We also did conduct a focus group with APS case workers and reporters, including the police. So we did all of that to understand the key issues. So we're going to move on quickly. So for our key findings, I want us to keep in mind that what we're trying to understand is APS's feedback policy and how that has an implication for reporting and also addressing elder mistreatment. So what we found is that there is what we call a feedback and response pathway when it comes to adult elder abuse and reporting and working with APS. And that pathway looks like this. It's in the intake part, the investigation, and then the case closure. So along this pathway, we found that there are different things that informs whether or not Adult Protective Services provides feedback to reporters. And I'm going to take you through a few of them. But before I do that, one of the things I want to clarify is, what does feedback mean in this context? So for us, feedback really is the information that APS provides to the reporter once they have made a report. So a few things inform that. We found that the type of feedback that APS provides to the reporter can take 2 forms. One, what we call procedural feedback, and the other one, substantive feedback. For the procedural feedback, pretty much process. Just APS provides information back to the reporter that just involves the process. For example, they would send an email or a letter or a text message to a reporter informing them that the case that they reported has been received, screened, or is being reviewed, something like that, just basic process information. And then the other type of feedback that APS would provide, that we found that APS can provide, is substantive. This goes beyond just the process and then involves things that relate to the outcome of the investigation. So APS could send a letter to a reporter saying that their report was substantiated or not, or that the victim has been referred to services, or that the case is closed. So that goes beyond just the basic type of information that involves processing. We also found that there's timing involved in this process. And when it comes to timing, that we found that at intake, most of the time that APS provide feedback to the reporter is happening at the intake level. And they provide procedural information at those stage. And then at the investigation, we found that minimal kind of feedback is happening between APS and the reporter. But at closure, that's where the least type of feedback is happening. We also found that there are risks and benefits to clients and APS, and that this risk and benefit informs whether or not, or determine whether or not APS would provide feedback to the reporter. Same with the reporter type and the relationship to the client. I'm going to emphasize this once in the next slide. So here, what we present here is not necessarily like novel, but it speaks to it helps us to understand the context from which APS makes the decision to provide feedback to reporters. And APS, again, Adult Protective Services, it informs why they provide or why they do not provide feedback to the reporter. And some basic things, the benefit and the reward, the burden and the risk informs whether they would provide feedback. But these things, they weigh it against the reporter type and the relationship that the reporter has with the client. So I'm going to take us through each of the boxes to explain what this might look like. So for example, if the reporter is a non-professional who has a brief involvement with the client, we see here that there is a weak benefit that APS or the client would receive from such relationship. And so providing feedback here is APS this would be the least kind of group that APS would provide feedback to because of the type of relationship that exists here. The non-professional, there's a higher burden or a higher risk here because they are non-professionals and they may use the information shared with them in ways that might cause further harm to the client. Also, because there's a brief involvement, there's not a lot of benefits that APS gets from providing feedback to this group of reporters. If we take a look at the professional with brief involvement, an example would be a physician who sees the older adults only one time. They are professionals, so the risk is lesser. So there's a lower risk here, like we can see here, there's a lower risk. However, and the reason why there's a lower is because they are professionals, they understand confidentiality laws. But because there is a brief involvement, the benefit is still weak. So there is not a lot of incentive for APS to provide feedback to this group of reporters. If we take a look at the non-professionals with ongoing involvement, because of their ongoing involvement, there is a strong benefit to providing feedback because then they can help with the investigation and also with whatever services that is being referred to the client afterwards. They can support that process. But because they are non-professionals, the risk is higher. So there's a higher risk of providing feedback because they also can use the information in ways that might not benefit the client. But this group of reporters, professionals with ongoing involvement, they are most likely to receive feedback from APS. They are individuals who are in ongoing relationship and they are professionals. They understand confidentiality law. And so they can help inform APS's investigation and also help support services rendered to the client. So I'm going to stop here and turn it over to Christine to take us through, the kind of recommendation we then came up with based on this type of reporters. Christine.
Thank you, Nikkei. And so once we had done all that research that Nikkei described, we did the interviews and focus groups, we did the environmental scan, we analyzed the results, and we had this idea, this kind of like decision-making model that Nikkei just showed you. What we wanted to do was take that to a next step where we could make recommendations to mainly Adult Protective Services about the types of feedback that they could provide to people that would hopefully increase people's willingness to make reports. Because what we heard over and over again is, I make a report to APS and nothing happens. It goes into a black hole and I never hear back and I don't want to report again if nothing's going to happen. And so what we did was take that research to APS folks in 4 different states and got them to do workshops with us so that we could come up with recommendations. So these recommendations are based on the research and the kind of rolling our sleeves up with people in APS in different states to be able to make recommendations that we think would be useful and help improve people's willingness to report and hopefully over time improve relationships between reporters of elder mistreatment and Adult Protective Services. So from this, we said, at intake, we think that no matter what type of reporter, professional or non-professional, all reporters should just receive some procedural information. That's to say, thank you, we're screening your case in, or screened out or in, and that's it. There's no harm in giving people that kind of first procedural information. No kind of private information is being shared. Then when you get to the investigation stage and the closure stage, then we have different recommendations based on the type of reporter, that is professional or non-professional, and how involved they are with the APS client that they're concerned about. So for non-professionals with brief involvement and professionals with brief involvement, procedural feedback, because we are concerned again that if they're only involved briefly, it may not be all that advantageous for the case if they have any more feedback. And then for non-professionals with ongoing involvement, that's really a case-by-case basis. And APS is really experienced at being able to figure out if it's appropriate to share more information based on how their interactions with that person are going. So there's some cases where APS will just, that this person who's a non-professional, and they may have ongoing involvement, so they may be really helpful to the case and it makes sense to share more information. But sometimes it's just somebody that, lives next door to the older adult or is a family member that has some sort of malicious intent, and we can't be sure that it's safe to share more information with them. They may be using it to, get leverage over other family members or something. So that's really case by case. Then it's the professionals with ongoing involvement, people who have a professional connection to the client and they can see the case through and maybe be of assistance in the investigation. That we really believe they should be having substantive feedback, more about the outcomes, because that person, that professional with ongoing involvement can A, help in the investigation potentially, and B, is likely to also see other older adults who may be reportable cases. And you want to maintain that good relationship between APS and a reporter who could have more eyes on and help address the issue in other patients. Patients, I say, because a lot of them are healthcare providers, but patients or clients. And then exactly the same idea with the case closure. Oh, thanks, Nikkei. And this diagram just simplifies it. So you can see here with a benefit to the client in APS when it's strongest and when the risk is lowest in the bottom right, professionals who have ongoing relationships, give them more substantive feedback and so forth. I mean, I won't repeat everything I just said, but this is a visual way to see why we made these decisions, because we wanted to be sensitive to the fact that there are real risks and benefits to APS and to the client of providing that substantive information. But based on the role of the reporter, we can make some informed recommendations. So let's pause there. And then our last content slide, I think, is how can we help? How can you help? So we know that reporting elder mistreatment is shared responsibility, and getting the cases to APS early can really help mitigate elder mistreatment before it gets even worse. So we encourage everybody to report suspected cases of elder abuse and neglect. I know Massachusetts APS folks have told us, report anytime you have a concern. You don't have to be able to prove that mistreatment is happening. We want to get the case in the system, and if it gets screened in, we'll follow through. And, worst case is it gets screened out, and that's okay, but at least have a chance for APS to address it. Watch for early identification signs. So the earlier, the more kind of upstream that we can get in the way that we address elder mistreatment, the better the outcomes will be for older adults. We do need to really advocate for sustaining APS funding. It comes up every time that we don't have enough funding for adult protective services. And so there's ways to stay involved and try to advocate for APS funding. The Elder Justice Coalition, and I can put a link in the chat in case people are interested in staying up to date on kind of elder justice policy. They're a great resource, and they send out updates about what they're doing to kind of advocate and lobby for more support for APS. And so you can follow along that way. I'll make sure I put it in the chat after this. And then championing public awareness initiatives on elder abuse and reporter trainings on what APS can and cannot do. For public awareness, we really encourage people to think about spreading the word about elder mistreatment, but always doing it from the position of having older adults in a position of strength, that we want to support older adults in a way that doesn't infantilize them or isn't overly kind of paternalistic. And we have some resources at the National Collaboratory to address elder mistreatment that can help. So I'll also put in our email there if people are interested in some of the getting pointed to some of the public awareness materials that we've used. And then reporter trainings on what APS can and cannot do. I know that the Massachusetts Adult Protective Services system is willing to they have people whose job it is to go out in the community and do education. So you can connect with your local APS and ask about trainings for various kind of audiences as needed. So let me pause there, ask Nikkei what I missed, and see if anybody has any questions.
Yeah, thank you so much, Christine. I think the only thing I'll add is the APS, what APS can and cannot do. A lot of times reporters think that APS, can take the older adult from their homes and just, take care. But then there's self-determination. The older adult has to consent to whether or not they want to be moved from the home. So having those education, both in the community and in professional settings, are always very helpful, that they are trained and knowledgeable about what APS can and cannot do. There's always this misconception that APS operates like CPS, like the Child Protective Services, and that's not true. And so there's always a need to continue to sensitize the public on these differences. And so we'll stop there and see if we have any questions. Yeah, I can pull down the slide so that we can see our faces better. Any question or thoughts?
If I may make a comment. I worked home care, and everything you've said so far is very well thought through, very valid. I find that the society, the beliefs of people kind of staying to themselves, people minding their business, I find that that's a very, I don't want to put it in the wrong way. I find it's a societal expectation for people to mind their business.
Mm-hmm.
So I think that APS is working against that societal way of thinking. People see things and they really do think, I should mind my business. It's not my business. And the next generation is actually going to be worse. I teach college now, and I hear it from the kids. And they all say, not my problem, not my business. I look the other way. So I think that there's a lot of work to be done in making people understand that minding your business, yeah, it's a good thing, but it's also a human thing. If you see something, just like the cops say, see something, say something.
Mm-hmm.
I do an experiment in my class of different scenarios, and I ask kids, what would you do? And most of the different scenarios I give to them, they basically say, it's not my business. It's not my business. So I really do think it's fighting a very serious societal norm to be able to pick up the phone, and the way that Adult Protective Services, their central response system now, the way you have to put in a report. I know we have someone here on Elder Services. Takes at least 15 minutes to do an online report. And if you decide to call it in, the interview is very long. And not a lot of people are interested in something they, to be able to spend that much time to be able to make a report. I know that they centralized it by putting in the central for the state. In the past, caregivers used to just call Elder Services in Worcester or Protective Services in Worcester and just make a report. And within 5-10 minutes, you're done. Now, staff members actually, they really do think about it because it will take a big chunk of their day to make a report. So what a lot of agencies, home care agencies actually did was to try to then say to staff, bring it to the supervisor. And so the supervisor who's sitting in the office will then take the time to make the report. And so this is something that I lived every day, trying to get staff to understand that, okay, you know what, we still, just as soon as let us know, and then we'll start to fill out the report for you, or we'll call it in for you. And you wonder how many other things in people's minds that they are wondering if they should report, but because of the cumbersomeness of the situation, they sit on it maybe a day or two longer just to see, okay, am I really reporting something, but I loved also what you were saying about maybe I understood it better for the first time, the response from the APS to different categories. It's something I heard in this community all the time, but we never hear back. And now I kind of understood it better for the first time, that if it's an ongoing professional person, you're more likely. And we did used to get feedback as home care agencies who were involved in cases, but I also used to hear it from the community, oh, we never hear back. And now I see it. So it was useful for me to see those different 4 categories and why some of the people would say, oh, maybe a neighbor or someone would say, oh, I reported it and nothing happened. So,
Thank you.
Thank you.
Thank you so much, Chizoma. Thank you. Maybe we take everybody and then we can just speak to each after. So I'll go, Amy, I know your hand was up a little earlier.
Yes. Thank you for that information. I never thought about the fact that protective services has the option of how much information to share with the reporter. So us being professionals, if we don't hear back, would you think the only reason is because they don't think it's?
No. So our research was about kind of what APS and what reporters would like, and our recommendations are what we think APS should do. That doesn't mean that's how the local APS is doing it. We know that in Massachusetts, they send the letters that include some outcome information, which is actually much more than most states do. Mm-hmm. We also heard from APS, and this is not specific to Massachusetts, but we heard from APS in several states, they're able to, within the confines of the privacy laws that they have to be very careful about, and putting in the front, the older adults' right to self-determination and their right to privacy, they're able to work with reporters in a way that they can get the information they need for the investigation and kind of convey enough information. They hope that it will be helpful to the person who made the report, but it's not our research showed that's not part of policy that they're doing that. So we developed these recommendations to try to get the APS as a field to move that way, to be more intentional about the types of feedback they provide to whom. And we know they can't provide substantive feedback to everybody because it could put people in danger. But when they can, to professionals, for example, with ongoing, we recommend that they do substantive feedback. But that's not to say that you should be getting feedback in a different way than you are now. Does that make sense?
Yes, it does. And I appreciate your making those recommendations.
Thank you.
It's very difficult to just make a report and not hear, as you know, and as Chizoma said. So, we want to be allies, and we try to make that clear.
Yeah.
Thank you, Amy. Kristen, sorry.
No, that's quite all right. First and foremost, I just wanted to say thank you to both of you for that presentation. I was actually found it really informative, and it was definitely I learned a lot. I really didn't quite know the whole process of how mistreatment of the elderly, how that's done, like what the process is to do that. And I'll be honest with you, I honestly thought that it was very similar to Child Protective Services. Like I thought they just go right in there and protect the elderly. I mean, almost kind of like they would do with the child, really get them out of that situation. I was actually curious, and I know this wasn't covered in the presentation, but I wanted to ask the question anyway. And this is something that I've wondered too, with my limited knowledge of abuse amongst the elderly. Is it? I'm just curious as to what is more common from the. I'm not even sure how to put this. Do you know, or is there any information as to where most of the abuse is derived from? Is it from a relative? Is it from a parent? Is, like a parent who's taking care of their parent, or I should say son or daughter taking care of their mother or father? Is it, a caregiver, whether it's at a retirement facility or whatever the case might be? I'm just kind of curious about that.
I don't remember the stats in terms of like the specific relationship. We do know that it is usually happens from somebody that's close to the older adult. That doesn't get to the detail that your question was, but it's much more likely than somebody that's kind of, just down the street or popping in occasionally. It's somebody that's really in a trust relationship with the older adult and is close to them.
Got it.
Our
Okay.
work has mostly focused on abuse in the community versus in a long-term care setting. So we know that also does happen, that, there's kind of staff to resident abuse as well. Our work was less about that, partly because in Massachusetts, it's a different reporting system for nursing homes than community-based.
Got it. Okay. Thank you.
Thank you.
Thank you. So I know we are running out of time, so I'm going to take Sarah and then, sorry, I'm not sure whose hand was first, but Sarah and Winsek, you can go. Anyone of you can go first.
I think Linda was first if she wants to.
Linda,
go
I'm
first.
sorry.
Oh, hi. That's all right. Quick. I just had one question on, so with our ASAP Protective Service, what they normally do is you make a report and then they'll send you a notice, whether it was screened in or screened out. Is that what you're referring to when you say closed out? Or are you referring to when the case was opened and then it was eventually closed out? Because the screening of in and out is what we don't always get on a regular basis. So we make a report and then we don't know whether they took it on or not. So
Yeah.
I guess that's where some frustration lies.
Yeah.
And whether we need to make another report, like a
Mhm.
second one, because the situation is still that way. Which
So-
if it was opened and we made another report, they just make note of it. But
Mhm.
I was wondering if it was mentioned difference between screened in and out versus open and closed.
Okay. Kristen, do you want to take it?
Sure. So
Then,
our
yeah.
recommendations are that for professionals with an ongoing relationship, they would get notified of each step of that pathway, that they would know if it was screened in or out, that they would know what the result of the investigation was, and whether it was substantiated. The piece about whether to report again, I don't know who's on here from APS. So I have heard from APS, you should report every time you have a concern in there. And especially if any of the information since the last time you reported has changed, to report again. The other thing we know is that one of the big reasons that APS can't do anything is because older adults have the right to self-determination, and they might say, I'm sorry, I don't want your services, and APS has to say, okay. So it may be the second or third or fourth time that APS knocks on their door that they've then got a rapport built a little bit. And they're like, oh, I remember you, fine, you can come in this time, and like, let's talk about what services I could put in place. So I think usually we recommend that you do report again. And even if you don't know, it could be the case that the older adult refused services, and that might not be their decision after a future report.
Yeah, but Linda, to the initial, I think that's what we are proposing in the all reporters, to have the procedure, and that would involve the screening, screen out. So we're
Yeah.
asking, yes. So because we know that that's where we really hear the concerns about, oh, it just goes into this black hole. We don't hear anything back. So we're asking that let there be procedural feedback to all reporters. Let them know that their cases was received, it was screened in or screened out, not that investigation had happened. But the closure piece is after the investigation, cases closed or cases referred for services. That's where that comes in. Yeah.
Right, because we think all types of reporters are valuable, right? So we want to give some sort of feedback, like you had a concern and you made this report and it was either appropriate and screened in or not appropriate and screened out. So we don't want to miss providing feedback to anybody at that early stage, because that's kind of, they're the surveillance system. All of us are potential, people that can help by making a report early. So we want to keep them engaged.
Right. And for professionals, when we make the report, we're looking for help. And if we're not going to get the help because the person said no or whatever, for whatever reason, then we need to know, okay, we've got to stay in there or get other help, look for other avenues. So it's
Right.
hard if we don't know what they're doing. I know we just keep reporting, but it would be nice to know, okay,
know,
yeah, they're not going to be able to, we've got to look elsewhere.
Got it.
Yeah. Thank you. Okay, sir.
I just wanted to say this is honestly great. I used to work in adult protective services a couple years ago, and honestly, everything you're kind of hitting the nail on the head. There's just a lack of communication, I feel. Yeah. I feel like once you get that initial report, it's like bing, bang, boom, you're calling everybody, you're talking to everybody, and then it just kind of falls short because then you're working specifically with the elder and you're not necessarily communicating and working with everybody else.
Yeah.
And on that same token, I think from my experience working there for so long, it's so hard to tell what people's motives are, especially when it's non-professional. They could be doing it for the love of the elder versus I don't like my sister, I'm trying to, get them removed. So that makes it difficult. So I know that back in the day we would do that, depending on who it is, are we able to share more information? Is it going to be beneficial without risking anything for the individual? And same with the elders, we can't just go in there and take them out. And I feel like that's one of the most difficult pieces that people don't understand. We can't section people because we don't have that ability. We're almost as frustrated as everybody else trying to get them the help that they need. Same with reporting over and over. Sometimes we would get 3 reports on the same person, and it just takes one different sentence that would make it get screened in versus screened out. So just very interesting. And then to Chizoma's point, I myself have put in reports too, and it's the most frustrating thing. It's not user friendly. I'd get kicked out if I was trying to look up things for 5 minutes. And then as a mandated reporter, if you call it in, you still have to fill out the online form and print it out and send it. So it's just extra steps that I think deters people from wanting to report.
Yeah.
But great job.
Thank you very much.
Thank you. Yeah. So if there's no other question at this time, Chizoma kind of highlights all of those because I said we're going to come back and we didn't make any comments right after your thoughts, Chizoma. But yes, I think it touches on what everybody else has said right now. I want to say thank you. And again, with that last slide, how can you help? The things we can all do in our own individual spaces, let's keep doing it. Yeah, thank you for having us. I'll turn it over.
Thank you both.
Right.
That was very good.
Thank you.
Thank you.
Thank you for the presentation. Yeah.
Thank you very
Amy,
much.
Next business is director's report.
Right.
I'll let you guys get to your business and
Thank
head out.
you so
Thank you so
much.
much. And
Thank
thanks so
you.
much for
Thank
the
you.
work you're all doing. Bye-bye.
Bye.
Okay, I will try to share my screen. And thanks again for coming out virtually in the snow. Here we go. So, as you know, this first section are the city's reporting on the city strategic plan goals. And I'm not going to go through everything. I assume you will read it. I sent it to you. We continue every month adding new programs, remote and on site. The diversity of our participants continues to be strong. The participation in the fitness center is really great. While we have over 1,300 members, they're not all active. As we know, we lose motivation, and or there are many reasons why you might take a break from exercising, but 883 have been active this year. So that's a lot of folks using the fitness center. It really is good in terms of economic growth and helping with the development of professionals in the field. Our latest additions are coming. We are probably going to have 3 volunteers from the Masters in Public Administration program at Clark. One of them is going to help with our annual evaluation, and Noreen admitting, and I'll report on the others as time goes on. And I know Patty has a couple of new interns coming, and she can talk about that. Nothing new on the last couple of things, so I'm moving along. What is the main thing? 2 excellent pieces about money. One is that, we got the field demonstration grant for the behavioral health for men's group, for clinician to run men's group. And it has been going great. However, we've discovered that it is cost prohibited to get them to sign up to use health insurance, and our funder, MCOA, has agreed to allow folks to stay on for a longer amount of time. And also Patty can give you the details, but just a few short months working with DPF, she was able to get all our kitchen equipment bought and installed through this grant of $37,000. So we're in good shape there. And Patty will tell you more about the various programs. We are 68% of our goal in terms of the numbers of different programs on site and online. She might highlight some of them, and Linda can talk more about direct services. Our staff is busy, hugely busy. And you'll see the chart. Because of open enrollment, of course, health insurance is getting the most attention, but there's a whole host of services that seniors are getting help with. Not much new for the next thing, and Patty will talk about facility and grounds. In terms of organizational structure and staff roles, our staff meeting presentations continued on what we do in our jobs, and I'm really enjoying it. So far, I presented Patty, Jenny for fiscal, and Vanessa for dementia. And besides just making sure everyone has a much better understanding about what our job consists of, I love the pride in which people report on what they're doing and get acknowledged. And we're in the middle of not in the middle, we're in the beginning of our budget process for 2027, and I've been discussing staffing needs with the acting commissioner of HHS, Alex Arriaga. No changes in renters. Rogerson is still engaged and interested in developing the affordable housing in the old part of the building, as evidenced by the visits we've had from their engineers. So we can remain hopeful and encouraged that it will happen. Marketing, let's see. Consistent Facebook numbers. We're a little bit higher than last year for average daily attendance. The fourth quarter, people counter, well, it's fourth quarter for the calendar year, it's second quarter for the fiscal year, but this goes by calendar year. It shows us that, December, there was a little bit less activity than November, and November, a little less activity than in October, all making sense because of the colder weather. But also, we're still had almost 92,000 people coming through the door in 2025. We were hoping it would get to 100,000 because that would be cool for no other reason though, right? But the 92,000 is a 9% increase from all of 2024. So we're very active. Patty can tell you more about working with our new Scoop publisher, and it's been a major transition, but super outcome so far. Interagency collaboration continues on many fronts. I did write a support letter for the Worcester Housing Authority's application for block grant funding to continue their transportation to and from the senior center for their residents. It's a program we started, I know, maybe 6 or 7 years ago now, and it works really, really well. And we are very grateful that the Housing Authority provides this for the seniors who live in their sites, and that the block grant helps to fund it. We really have to do a patchwork quilt for transportation, and this is an important part. So, and everybody got this email, I hope, about the changes, mainly because of Memorial Day. Pavel is just joining us, and Noreen has come in late also. So if you know right now, I would like to hear if this is a major problem for anybody in terms of the new date.
The new
I feel like
schedule.
those are way
okay
too
with
far
me.
away for me to know.
So
Amy, I think you're frozen.
yeah, am I back?
Yep.
Yes,
Yes.
I'm back,
Yes.
right? Okay.
Yes.
Well, that was a good time since I finished. So we can move on to Patty.
All right.
Yeah,
I'll
I
be
have
quick
to excuse
since
myself from the 27th of April meeting. I'll be out of the country.
Okay, good to know. We'll see if it becomes a major problem for quorum.
So I'll start with, we had a large flood, started in the boiler room and went to the kitchen, and it was the day after Christmas, and it was a big mess. Thank goodness for DPF, the Department of Public Facilities, who man the building. They did a fabulous job cleaning up, and they're actually still cleaning up some of the residual mess of that, like ceiling tiles, lighting, things like that. But that should be all squared away at the moment. And it did come at a very untimely time. Not that any flood is timely, but it was when they were in the midst of helping with all the equipment, the new equipment coming in. And again, they were huge help with that. It was quite the team effort getting everything in, because it was a lot of work with all that equipment and everything. But that has all been, like Amy said, it's all been installed. They're winding down, following up with just coming in with last minute inspections to make sure everything's working properly. And also timely is our new plow company. I actually checked on the last couple storms, and they're doing a really good job from what I'm hearing so far. Today's is probably going to be quite the challenge, but we'll see how it goes. I did check in, and they said so far so good. They were doing a decent job cleaning up as best they can with the amount. A few highlights. Taxes are starting at the beginning of, I actually wrote June, but it is February, so I'm thinking warmer weather. We have 2 interns starting, as Amy mentioned, one from Quincy Community College in Human Services, and she's going to be working with our respite program and dementia-friendly Worcester efforts in the Memory Cafe. And then we also have a Worcester State student who is from Haiti, and he is very excited and gung-ho, and is going to be doing some research for us, also working with Linda and possibly other staff as well, kind of a shared effort among staff, but wants to really focus on health programs with seniors, and plans to do some tabling in the lobby to get an idea of what people what classes they go to, what classes we don't have that they'd like to see, like just what motivates them to exercise, because we have some dedicated people that are there getting in line every morning to go to the fitness room. So I think it's going to be very interesting to hear. He's also going to work to try to bring to outreach to the Haitian elder community, and get maybe at least alert them to what goes on at the senior center and whatnot. So he was very excited about that as well, and already has some churches that he plans to approach. Dementia Friendly Worcester, our next meeting is in March. We had a meeting online in January, starting to set goals for the new year. So Linda may be probably going to talk about the Alzheimer's Partnership Program, and we're going to partner with them and whatever needs they have for us to be involved. We are also planning a Dementia Friends session in the spring. So if anybody would like to get trained for that, they can reach out to myself or Vanessa, our Dementia Friendly coordinator. We have a wait list, actually. We have people from Dementia Friendly Worcester, the team who have staff and whatnot who want to be trained. And we also have people, our staff, and some volunteers and tenants in the building. So we have a list going, and we plan to do that again in the spring. And so in regards to programs, it's going to be a big day on Wednesday. We hope people are ready to, hope they get shoveled out to come to our program. So, and then like poor Suki, she's already worried and anxious about getting ready for this one. So it's UMass is doing a neurology talk. It's UMass residents. Neurology residents. So this is on Wednesday, and there's a whole piece to it with a coffee and a sponsorship and a sponsored lunch and then entertainment. So it's one of her whole day events and a lot of pieces to it. So she's hoping everything's all cleaned up and ready to go by then. But so our whole focus on January for programming has been brain health. Vanessa and Shirley, Suki and Shirley, started it and ran with it, and they had the coolest program on last Friday. It was called Piece by Piece, Puzzle Race for Brain Health. So Right at Home and Lutheran Home Care sponsored a puzzle making contest. And I walked into the room and you could hear a pin drop. They were so focused on what they were doing and so intent that, trying to get this puzzle. They did 500-piece puzzle, and there was a winner. Someone did finish, more than one, I think, finished, but it was just something new to us, never have done it, and it was really fun and entertaining. Also this week, Jason Wickman is coming. He is a competitive speed cuber. He happens to be one of the children from Leah, who manages the Worcester Fitness Center for us. And so he is going to come and show us how he does it. Bingo size has been going very strong because it kind of has a lot to do with bingo itself, and people love that. So they're getting a good group of people in, but they're learning about health and exercise while they're doing it, and they're having fun with it. A new osteoporosis class has started. And then we also had a coffee with the doctor and a urology talk this month that were both very well attended and interesting. And then Belltone came and did, they cleaned hearing aids and they did screenings. So that was popular as well. February is all about healthy heart. So there's a healthy heart cooking class with Lutheran. There is a heart and healing, a Valentine self-love workshop coming up, a path to better wellness and interactive Heart Month seminar coming on the 13th. And it would not be Valentine's Day for us without Elvis. So there will be a talk, and then that's the Better Wellness Talk, a distinguished speaker series, and then Elvis in the afternoon. So just some quick highlights. Any questions? Maybe Linda?
Yeah. So as far as senior service staff goes, we're continuing to help people with housing, food access, transportation, fuel assistance. So the norm. We haven't had anyone who's run out of their fuel assistance benefits. Some still haven't gotten them because it's been delayed because of the federal government shutdown and the shortage in staff. But we're all working with everyone. That's going well. But they'll help me get connected with an owner of 2 rest homes who we're going to meet with very shortly to see how he can help us maybe house some of the people who are recently losing their apartment, or, rather than be on the streets or in a shelter. So that's really good news, and that's supposed to happen this week or next. So we're looking forward to that. Also, no surprise, we know the number of homeless seniors is on the rise. That's something we've known right along. Senior Connections reported that at one of the meetings I attend. So, everyone's aware of it. It's just, how do we help all these people who are need somewhere to go? And as far as programming, we're continuing to do the elder groups, which now we're calling elder social groups. And they're well attended. The Arabic elder group has an increase in numbers again. And we've brought back the Arabic meal once a month. So that's all positive news. We're the Chinese elder group and the Vietnamese social group will be doing their Lunar New Year's in February. So that's exciting, along with everything else Patty reported on for February. We will be doing the program with the Alzheimer's Partnership and Dementia Friendly as Worcester. As Patty said, that's the first Monday in April. We're having our big meeting about that tomorrow, so I'll have more information to share at our next meeting. We do have a doctor from McLean Hospital coming to speak, and that's for professionals. And it was well attended last year, and people are looking forward to it again this year. And we will be helping with the UMass Med Students Clerkship again, the Geriatric Fall Risk Prevention Clerkship. The 3rd week for the first session of students is taking place in March, and then the they've switched it up again. So now the next year's students will be coming in April and we'll be doing 2 weeks with those. So it's 3 weeks total working with those students on fall risk prevention. And seniors, there continues to be on the 911 call list, we get between 20 and 25% of all the calls are fall related. It just doesn't seem to go down. That's just what happens. We've done different things in the past to try to work on it. And we're continually looking at it, and Bo from St. Paul's Elder Outreach follows up with people about their falls. So we're still out there trying. And we certainly offer enough exercise classes to help people with their core strength and flexibility and balance. So it's just getting people to come out to do those. So, but our numbers are up with all that. So I guess that's good. And was there anything else I needed to address that I didn't? Nope. Okay.
It's amazing to hear all the program and activity and all the achievement that the Worcester Senior Center do and you all do. We really appreciate for your work.
Thank
I
you.
second that. I second.
Thank you.
Sure.
And thank you, Noreen, for joining us. Noreen had to go into work today, so juggling for everybody. And thank you, Faseli, for filling in.
Of course.
Yeah, thank you for selling. Yeah, it's been a interesting day for sure.
Okay.
Okay. Do we want to entertain a motion to adjourn?
I make a
Yes,
motion.
I make the motion to adjourn.
Second.
Second.
All in favor?
Aye.
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 All right. Meeting is adjourned. Thank you, everybody. Stay warm.
Thank you.
Thanks. Take
Thank
care.
you. Happy New Year.
See
You too.
you.
Take care.
Bye.
Thank you.
Bye.
Thank you.